Good morning, Anjana. Yes. Yes, Anjana.
Yes, sir.
Yeah, good
Morning.
morning. How are you?
Fine, sir.
Yeah. So you can discuss your problems with me. So when is your test date? Did you plan?
Sir, I'm actually want to book my exam in the month of April,
April.
15th April.
Okay. Okay. Fine. Fine. So what we can do is we'll do one mock test tomorrow. Tomorrow is a Saturday. Okay.
Okay, sir.
You do complete mock test. So listening, reading, writing, speaking, everything you can do. And then based on that one, we'll decide which date to take. Okay.
Okay, sir.
Because just blindly we cannot go and book the test, right? I think you agree with me what I'm telling you.
Yes, sir.
So what we'll do is tomorrow, fix a time for the test. If you are available tomorrow. Tomorrow, are you working?
No, sir.
So 1 second. Right. Yeah. So, right. So number 1, Anjana Yadav. Anjana Yadav. So tomorrow you'll be doing a mock test. I'll give you the materials. You can print them and keep them ready. Or you have any test already printed that you can use, no problem. So one test you have to take and systematically you have to follow that. Okay. You have to follow that systematically. Right. Now what we'll do is we are online, right? No problem. So you can practice with me on a daily basis. Whenever you are free, you can come like this and we can do the sessions, right?
Okay,
Okay.
sir.
So what you can do is, so did you do any speaking session before with me?
No, sir.
So, okay, fine. Anjana Yadav. Anjana. Yes. Right. So you're focusing on all the 4 skills, right?
Yes, sir.
You're focusing on all the four skills, right? So you are going to do the mock test tomorrow. Mock test. So number one, Anjana Yadav. So we'll decide. So you have to send a timetable for tomorrow, and you have to sit and do the questions, and you will not correct them. I will correct them for you. Okay. You should
Okay.
send them all. You should send them all to me. So based on that one, I will tell you which date you can go for the exam, and we'll discuss it online, and you can practice it. You can definitely practice it. Okay.
So 10 to 2.
10 to 2. Okay. So Anjana Yadav. So you can take your test. Fine. 10 to 2. So 10 o'clock will be your listening. 11 o'clock will be reading. Okay.
Yes, sir.
So 10 to 2. 10 o'clock listening. 11 o'clock reading. 12 o'clock writing. 1 o'clock speaking. Okay. Speaking time may vary according to the slots. Okay. Listening, reading, writing, and speaking. Right. We are going to, yes. Yeah. Right. So, Anjana Yadav, you'll be doing a test tomorrow, 10 o'clock, 11 o'clock, 12 o'clock, and 1 o'clock. All the four skills, and we'll assess them in the style of OET. We'll check how far you can get through. So, based on that one, we can plan our test date. So, do you agree?
Yes, sir.
Right. That's good. Yeah. So, fine. Pranita Pamarti. Hello, Pranita.
Good morning, sir.
Good morning. So this is your attendance, Pranita Pamarti. So tomorrow you can do one full test. Are you ready to do a full test tomorrow?
Full test means all listening, reading.
You will
full
do one reading, you will do one listening, you will do one writing, you will do one speaking. One full test.
Actually, I don't know, sir, that writing as I didn't
Okay,
write.
no problem. No problem. Whatever you know, you try. Now, it's not necessary that you are going to write the OET exam tomorrow. At least you will know the pattern, right?
Yes, sir.
You will know the weak areas, right?
Yes, yes.
You'll at least know how much difficulty it is, how many answers you can understand, what is the difficulty level. You will learn at least some idea, right?
Yes, sir.
Okay, so right, do it and finish it off, no problem. If you get even 0 marks, no problem. What is the problem in that one? And I don't think you are doing well, so definitely at least you'll get say 100 marks. Okay, more than that you'll get. That's not a problem. At least you'll get an idea of how to do. Okay.
Okay, sir. I will try
So
for that.
this week, this Saturday, tomorrow, you'll do the test. Maybe you are getting, for example, 100 marks in listening. So next week you'll get 120 maybe. You'll see, at least you'll see how progress. If you don't do test, no, you will not know where you stand, right?
Yes, sir.
When you do mistakes, you will know where you have to recover, where you have to improve, how to, what you will know. You'll ask me then, sir, this is my area of difficulty, sir. Part A is very difficult, sir. I am not able, at least you will tell something to me, right?
Okay, sir.
So just an idea, no problem. It's not not going to do any. It's not going to pose any problem to you. So just do one test and submit me tomorrow. Okay. So you decide and tell me what time you want to prefer.
Sir, tomorrow or day after tomorrow, otherwise later also I will do like that.
No, tomorrow only mock test, ne?
Oh, okay.
Tomorrow
Okay,
we
sir.
are doing the mock test, right?
Okay. Tomorrow in morning I will submit, sir.
Okay, morning, what time you think?
Like here means wait, 9 or 9:30 like that.
India time.
Yes, sir.
Okay, 9 o'clock. Okay. So 9, then 10, then 11, then 12. Okay, fine. So we'll do like that one. So timing of this may change, no problem. So you can keep the printed materials. You can tell me, you can update the status. You need to have one test, one reading, one listening, one writing, one speaking. Take it, select it now itself, today itself, and then you can keep it separate. So you can write on the top 9 o'clock, 10 o'clock, 11 o'clock, 12 o'clock, like that. So you can select your own materials and keep them. Don't open them. Tomorrow you can do them. Okay.
Okay.
And you should just message me what what question paper you are doing. Okay, for example, reading, what is the name of the reading, so that you can write like that. And for example, burns, what is the title in the beginning, that you can see. Okay, and you can message me. Fine.
Okay, sir. Fine.
Right. Yeah. Then Blessing Erisaba. Hello, Blessing.
Hello, sir. Good morning, sir.
Yeah, good morning, Blessing. What is the time for you there now?
6 a.m.
Yeah. So you can mention the time, what time. Tomorrow you are going to do a test. However, you are doing whatever you know, based on that one, you will do the test.
Okay, sir. I don't know where I'll pick the materials from. Shall I just pick anyone from the group?
Okay. Yeah, you can take from the group materials and you can
Oh,
print. If you don't have, I already gave in the group, so you can take those and you can practice.
okay, sir.
Yeah, what time you want to do, you just let me know. Think about it according to your timing and check the time difference and let me know. Otherwise, I will definitely help you. Right.
Okay, sir.
Then, so you will do one test tomorrow, Pranit. So, Blessing Erisaba.
Okay, sir.
Erisaba. If you give the timing, then I'll schedule your timings. Okay. And you can select the materials and you can print and keep them. Don't just do from mobile, print and do them. Try to make procure the materials for you. Okay.
Okay, I should print
So
the
now,
material.
yeah, very good, very good. You can print the material. Okay, fine. Now let us start with Anjana Yadav. Hello, Anjana Yadav.
Yes, sir.
I'm going to give you a speaking card now. Okay. So you can take one speaking card, card number 1. Right. Speaking card. I'll send you. Anjana Yadav. Okay. Yes. No problem. However you do, it's okay. No need to worry. No need to panic. So speaking, test, nursing, 1. Yes. Nursing, test, PDF, 1, speaking. Yeah. Here is the sample. So this is the card here. This
Sir,
is the
card number 1.
Diabetes. The card is in front of you. You can see. Can you see? Can you see the card?
No, sir.
Okay, fine. Yeah. So here is the card for you. Can you see now?
Yes, sir.
So you have 3 minutes to prepare.
Okay, sir.
So whenever you are doing the speaking, you have to look at this candidate card, not the role players. Don't see this one, patient card, role player card. Don't see this one. You have to see the candidate card. So this is your
Okay,
card.
sir.
Is that clear for you now? Yeah. Yes, you have 3 minutes. Yes. So next, Pranita, it will be your turn. So Anjana Yadav. Hello, Anjana Yadav, unmute. You can unmute. Yes. Okay, are you ready?
Yes, sir.
Okay. You need a time, you check, no problem. If you need time, it's okay. You go through that. And once you are ready, you can straight away start.
Okay, sir. Okay, sir.
Yes.
Shall I start, sir?
Yeah, of course.
Good morning.
Good morning, nurse.
Please come and have your seat.
Thank you very much.
My name is Anjana Yadav, one of the registered nurses working in this medical clinic. If I'm thinking correctly, you are Mr. Lincoln.
Yes, of course, you're absolutely right, nurse.
Okay, Mr. Lincoln, nice to meet you.
Thank you very much.
Mr. Lincoln, today you are here to know more about the self-administering injections for diabetes and for advices. Am I right?
Yes, of course, nurse, you're absolutely right.
Okay. Could you please tell me how are you feeling about the insulin injections?
Actually, nurse, to speak frankly, I'm a bit anxious about these insulin injections. I don't know why the doctor has recommended insulin injections. What's the reason behind it? But I'm unsure about starting insulin injections. The reason being I'm scared of insulin injections. Taking injections itself. I'm managing my diabetes diet very excellently with my medication, exercise, and diet. Then why is this change in the first place?
Oh, Mr. Lincoln, your concerns are quite reasonable. But here I would like to mention that you told me you are following doctor's advices, like you are following diet and you are doing exercises, and you have fear to have this insulin injection because you have to take by it by yourself. I do understand, but Mr. Lincoln, your sugar level is increased by following all these things. So it is very much important for you to have this insulin injection to maintain your glucose level in the blood. I hope you are getting my point.
Yeah, of course. But the thing is, I don't just really like the thought of injecting myself because I don't think I can be able to do it. It scares me. I'm afraid.
Okay, Mr. Lincoln, your worries are reasonable, but I would like to assure you that this process is very simple, and taking injection, it's natural for everybody, but it is not painful. I would like to assure you that I will give you the demonstration and how to take injection, so you get the to reduce your anxiety and uh, fear about the needles. I hope you are following me.
Yeah, of course, nurse.
Mhm. And Mr. Lincoln, firstly, I would like to tell you about the instructions which you have to follow. And by doing practice on regular basis, you will get more confident to have the injection, and you are not going to have fear about taking injections. So shall I start? Shall I tell you about that?
One request, nurse. Is there any other way to manage my diabetes other than these insulin injections?
Oh, Mr. Lincoln, I can understand your feelings. You are not willing to have this injection, but insulin injection is very much important in your case because it is fast acting. It will absorb in blood uh, very quickly, and it will lower the blood glucose level in your blood, because the other treatment you are having, it is not effective in this case. Okay.
Okay, nurse, I understand. All of that information is very clear. Okay,
Okay.
yeah, you can now tell me what am I supposed to do? Explain me the procedure and everything related to this insulin injections, if that is the case.
Okay, Mr. Lincoln, thank you for your permission. Firstly, you have to wash your hand and dry, and you have to clean the area. I will tell you at which area you have to take this injection, on upper arms, on thigh, on abdomen. I will give you the clear instructions where you have to inject this insulin injection. And before having this injection, you have to clean the site, and you have to insert the needle at 45 to 90-degree angle. Are you able to follow my advice?
Yes, of course, nurse, the information is clear. Go on.
And after that, you have to leave the needle for 5 to 10 seconds. Okay, so the all medication will insert inside the muscles. Can you do this?
Yeah, of course, definitely I'll do that one. And what about these injections and syringes and needles? Should I use the same thing time and again, or should I change? I should take a new one every other day.
It's a very good question from your side, Mr. Lincoln. It is very important. You have to rotate the injection site, because if you are not doing this, it will create lumps, and there is a risk of less insulin absorption in the blood. So you have to rotate the site, and you have to keep that container insulin injection in the freeze and check the expiry date. Are you able to do this?
Yeah, definitely I will do that one. And what about these used syringes and needles? What am I supposed to do with them?
Okay, and for that, Mr. Lincoln, you have to use a box. Definitely, we will provide you. And you, after using the needle, you have to keep inside that box. Do not throw anywhere else, because it is harmful for you and as well as for the others. So I can arrange that box for you. Is that okay with you?
Yeah, that's fine. And what if the box is filled?
Okay, I will put the mark at which level, till which level you can use that box. After that, I will come and collect this box and dispose in the hospital. I hope all the procedure is clear till now.
Yes, of course, everything is fine. And is there anything else that I need to know, nurse?
Um, Yes, one thing I forget to tell you, for that I'm really very sorry. Now I'm going to tell you that please do not expose this insulin injection to the sunlight, or do not keep this injection in high temperature. I hope now it is clear for you.
Yeah, of course, that's very fine. Thank you very much, nurse. And it was really valuable information that you have given me. Thank you once again for your kindness and patience. Now I am ready. I feel better about the injections now, and I am ready for you to watch me give myself an injection and guide me and help me step by step.
Mhm. Thank you, Mr. Lincoln. I really appreciate you for your willingness. Now I will show you how to take self insulin injection. Thank you so much for your cooperation.
Yeah, that's very fine. Yeah, now let me give you some feedback regarding the session you have done now. First and
Yes.
foremost, you said advices. There is nothing called advices. Advice is uncountable. You cannot say plural. It is uncountable. You cannot say advices. I will give you some advice. There you cannot say I will give you one advice. I'll give you two advices, three advices like that. There is nothing like that. It is advice. That's all. So advises is there. That is verb. Advise. This is advice. It's singular. And the thing is, you have repeated this one. Not
Yes,
once,
sir.
twice you have told. And then you say, okay, Mr. Wilson, these unnecessary sounds, this shows your lack of readiness to speak the next sentence. Your mind has not generated a new sentence and you're waiting for that one. You're thinking, instead of opening your mouth and about to start and you realize that you don't have a sentence, what you can do is you can close your mouth, zip your lips tight, don't open the mouth, and only when you wait for 1 or 2 seconds, rather than opening your mouth and giving a random sound, just close your mouth so that no sound comes out. So that will help you a little better, a little late than confusing, okay, yourself. The next thing is you're saying Mr. Lincoln, Mr. Lincoln, Mr. Lincoln, number of times. I know my name is Mr. Lincoln, and you know that my name is Mr. Lincoln. And the third point is nobody else is there, only you and I, okay? Both of us are there in the room. Then why are you repeating the name Mr. Lincoln, Mr. Lincoln, Mr. Lincoln? And nobody will be ready to listen to the name of a person. Okay, initially you said, okay, you are Mr. Lincoln, this is for confirmation purpose, but there is no need. See, every time I'm not telling you Anjana, Anjana, Anjana. I know only Anjana is there. There are other people in the chamber, but they will not talk. Only you and I are in between the conversation, in the conversation. So no need to tell by name every time. Okay.
Okay,
Right.
sir.
That's, you have to avoid that one. The next one is it. You should take it. You should do the it. Okay, it is important. So the word it. Then you have to do this. You have to take this. You have to take the injection. You have to rotate the sides. This you. Then I will explain you. I will tell you. I will inform you. I will demonstrate you. I am going to show you. All this I will give you a container. Okay. So this these are personal pronouns. Avoid them as far as possible. Now that is very important because this deteriorates the quality. These things deteriorate the quality of speaking. So instead of saying, I will explain you, you can say explanation will be provided. Information will be explained. Procedure will be explained. So the necessary steps will be explained in detail. So like that, you start with that particular word which is more important in the sentence. Medications will be provided. Explanation will be given. Demonstration will be provided. Suggestions will be offered. So suggestions. So your advice is the word. Advice regarding self-injecting insulin will be provided. So like that one. So this is the way how you can use. So avoid personal pronouns as far as possible. And you are using a lot of active voice. Active voice is good, no doubt regarding that. Active voice is good. It's not wrong. But the thing is, you know, instead of using active voice, OET recommends passive voice. Passive voice, when you are using, you will give importance to the patient. You'll give importance to the thing acted upon. So what is the most important thing there? Focus on that thing. For in a particular sentence, you are introducing, every sentence, you are introducing something new. So that one which is new, you have to use in the beginning of the sentence. For example, injections should be taken on a regular daily basis. The 5 locations or the sites for the injection are the 2 shoulders, the two thighs, and the area around the umbilical, okay, belly button. So this is the way how you can talk. So the four sides, right? Education will be provided, explanation will be given, container will be given to you. The needles and syringes which are used, the used needles and syringes should be disposed into the container. Open the lid, dispose them into the container, and close the lid. That's it. I'm not telling you should take the syringe, you should open the lid, you should drop the syringes, used syringes and needles into the container, and you should close it tightly and put it in a safe, okay, zone, away from the reach of children and other people, to avoid any needle prick injuries. So this is the way. So you will talk with a style. So you can definitely score B plus, or if possible A also, if you improve your quality. Then next one is passive voice over. Then on upper arm, on thigh, on. So this is what you are doing. On upper arm, on thigh. So on the upper arms, the upper arms. Whenever there is a body part, you have to use the word the. On upper arm. Which upper arm, left or right? Why are you using singular? You have only one arm, or I have only one arm? You are misrepresenting things. On upper arm. Now I have a confusion. Left, right upper arm or left upper arm? So the way you expressed, there are many mistakes there actually. You can say on the upper arms, because two arms are there. One the left arm and one the right arm. So how can you use singular? When you are using arm, on a upper arm, then you have to say a. But it is not a, it's the upper arms, the left and the right. Then the thighs, the thighs. You said on upper arm, on thigh, on thigh. I have two thighs. Now on which thigh? You're confusing me. I don't know which thigh I have to take. I have to take on the left thigh, or I have to take on the right thigh. Which thigh? So there are two thighs. So you can say on the thighs, on both the thighs, and the area around the belly button. So this is the way how you can speak. Is that clear?
Yes, sir.
And now I'm going to give you some more points. Yeah, the things which I'm going to tell you. First thing is introduction. You have to create a solid introduction. Yes, this is a medical clinic. You know that it's a medical clinic. So somebody is coming to you and going to ask you, welcome to the medical clinic. I am the registered nurse here. And if I am not wrong, you are Mr. Alexander or Margaret. Please come on, have your seat. Can I know the reason why you are visiting the medical clinic? If you don't mind, I would appreciate if you tell me the reason for your visit. You don't tell that you are here, you don't reveal everything. Try to involve him. If you tell, he will say yes, or he will say no. Why don't you make him talk? Let him tell. It is his problem. It is his reason why he came. So give him a chance to speak, nah? So that he will be comfortable, right? So give them a chance. So yeah, if I will be extremely pleased if you can provide me with the information, or provide me the reason for your visit to the medical clinic. And before that, may I know your name and age, please, for documentation purposes. I would like to confirm your name and your age. So this is the way how you can start the introduction. Then confidence level. Your confidence level is good, no doubt regarding that. You're speaking well. And you have to improve your confidence level by learning more, practice more, Okay. In the beginning, don't come directly for taking the test like this. You take another card. The card which I take with you, I will not give you. Just 3 minutes before I'll give you. So you can take another card and you can prepare sentences. You can write down those sentences and you can improve those sentences. You can take the similar role play cards which are given in the Telegram channel, okay, or in the WhatsApp groups. Then what you can do is you can listen to the others, identify who are the best speakers, okay, identify what are the best sentences and try to flaunt those sentences in your speech. Try to write down those sentences, modify, mold, change, alter, transform, do whatever you want. Take those sentences, write down and work out on those sentences, improvise them, enhance the quality, empower yourself with extraordinary styles. That's what you can do. With that you will get confidence. Then you can take ordinary sentences of other students and his speaking is ordinary or his sentences are ordinary. Take those ordinary sentences and improvise in your style. Then take the weak students' speaking sessions, write down their sentences, find out, identify the flaws, identify the mistakes they are doing, see that you will not do those mistakes. Okay, learn, because I give corrections at the end of every session. I give corrections. After 5 minutes or 6 minutes, there are my suggestions. So you can take my sentences, which are standard sentences, A-grade sentences, which I will be giving you. So those sentences you can use in your speaking. So try to categorize them. Extraordinary sentences, example sentences given by your grandmaster or a teacher or Mr. Simon, whoever is giving you extraordinary sentences correctly. Write down those sentences separately. Write down the best sentences of others and try to use them and transform them. Try to write the mediocre sentences and improvise them. And try to write the good sentences or ordinary, very low level sentences and try to see that you will not do those mistakes. You try to not repeat those styles and you have to, all are good for your nourishment. The next one, grammar. You have to work on grammar. Your sentences are not very extraordinary. You can say like this: if you take the medication regularly, if you take the insulin injections on a daily basis, you can manage with your condition very excellently. You can lead a normal life. So you are using if. Okay, this is the way how you can do. So grammar, if. You can use but. You have to take the medications on a regular basis, but you have to follow the instructions. Use but. Despite taking the insulin injections on a regular basis, if there are any complications, follow up with us. You can call me or meet me personally, or you can ring the doctor, or you can visit the clinic and you can take an appointment with the doctor and then discuss your problems. So different sentences you're joining and making extraordinary sentences. You're using simple sentence, complex sentence, compound sentence. For example, despite taking medications, if you feel no improvement, then contact the doctor. If everything is going on smoothly, then you can relax. If is making a complex sentence. But take these injections regularly, but follow the instructions, because medication compliance is necessary. So if, because, like that, you are used it, but you can use the sentence but. So there are many words you can use, conjunctions, and you can make extraordinary styles. The next one is vocabulary. Take the words, try to understand. Don't use the word good. Don't use the word good. Use the word awesome, excellent, extraordinary. Okay, wonderful. I observe excellent progress. Okay, don't say the word good. Okay. You should take the medications regularly. Medication compliance is required, is needed. Don't use the word needed, say required. So vocabulary, you can use C1, C2 vocabulary. I have given a lot of words. You can improve on that. The next one is pronunciation. How to improve your pronunciation? Take the audios which are given and you put the audios, play the audios and try to catch the words and try to pronounce in the way how the speaker is pronouncing. The next one, sentence structures. What do you mean by sentence structures? I told you simple sentence, complex sentence, compound sentence. Sentence structures are using, for example, to infinitive. I want to play football every day. I like playing football every day. Playing football is gerund. To play is to infinitive. I like to play football every day. I love playing football every day. Both are the same meaning. Both are the same. But this is to infinitive, that is gerund. They may mean differently. Playing football, the act of playing football. To play, want to play means this is a desire. Okay. So you can change your styles and sentence structures. Next one, accuracy. Accuracy is related to grammar. Accuracy is related to vocabulary. Accuracy is related to pronunciation. So all this accuracy you have to try to improve. Then next, the fluency. Fluency means the flow of speech. For example, you can speak fast, you can speak slow, you can speak moderately, you can speak very fast, or you can speak very slow also. So these are the 5 ranges of speaking. Very fast, fast, moderate, slow, very slow. There is no problem. All these are acceptable. But the fluency is to be maintained. That means the flow of speech. For example, when you're speaking very fast. When you're speaking very fast, you may make some mistakes. So you have to be very careful. This is very fast. When you're speaking very fast, you have to be careful because you are doing some mistakes. Now, moderate. If you are speaking very fast, you will make mistakes. So you have to be very careful. Slow. If you make mistakes, it will be a problem. So you have to be careful. Very slow. If you make a mistake, it's very problematic for you, and therefore you have to be very careful. What's the problem? There is no problem at all. All the 5 are acceptable unless and until fluency is maintained. The continuity, the flow of words, one after another, one after another, one after another. The fluency is maintained unless and until there is a pause or a full stop, you are not stopping. That is called fluency. So only you should not spoil the fluency. For example, fluency is important, but you have to be careful, otherwise it will be difficult. So this is lacking fluency. Do you understand, Anjana?
Yes, sir.
So next one, fluency. Passive voice. Use passive voice because passive voice is the demand of the OET. Don't give active voice. Avoid active voice and use passive voice. Learn how to make sentences. So flow of thought, idea generation. So how to speak, what is the next sentence? If you speak very fast and your idea generation is slow, then your words will be finished. What next, you'll be confused and you'll start stuttering or stammering. So be careful. Talk slowly, no problem. Then next one, subject knowledge. For example, you don't have much knowledge regarding insulin injections. So that's why you did not speak much. Or maybe you have the knowledge, but you forgot using those things. For example, you can speak like this. You could have told this sentence. After considering all the possible options, then finally doctor has eliminated them and prescribed you insulin injections. Because the other styles will not be effective anymore because the condition of your body has changed drastically. Your body cannot cope with the present situation. So therefore, you have to take insulin injections on a regular basis, and this is the only one and only way, and it is the best possible way. Till now, it was okay. That is why doctor was well with your medication and a dietary regimen. But now the condition worsened, and therefore the demand of the day is self-injecting insulin injections. Do you understand? You did not use this. You know all these things, but you did not use. Is that clear, Anjana?
Yes, sir.
You can. Remember that. Then next one, reassurance. You did not give much reassurance. You did not give much reassurance. You did not convince me. You could have told like this. You have knowledge, but what is the use? What is the use? Open the tap and fill the water and use it for daily purposes. You're not using it. You have, the tank is full. This is the tank and it is full, but you're not using it. You're not tapping it on. Tap the button of your brain and things will flow. You have told like this one, reassurance. There are a number of people who are facing this problem. You are one among them, that's all. All these people are able to manage their condition with insulin injections. And they are leading a normal life without any complication. The only difference is they are taking insulin injections. Otherwise, everything is common with the others. It does not take much difference. And if all these people are able to survive and lead a wonderful life, then why not you? If I were in your situation, I would have taken it, because I know as a nurse, I know the importance of self-injecting insulin injections. It's not a Herculean task. Gradually, slowly and steadily, you will gain the knowledge, and maybe within a couple of days, or if you face any difficulty, maximum within a week, you will become perfect in taking insulin injections. And I'm going to support you in every way. Until you are confident, I will be with you. Either you can come to the clinic or I can come to your place and I can train you perfectly. And when you're confidently, then only I will leave you on your own. How does that sound? Yeah, now tell me, how was that?
Sir, it is really very good. Excellent.
That's what it is. Transform. Operation Transformation Absolute. Transform your style. I will not take too many sessions. I have already given practice sessions. Now I'm giving you testing sessions. This is what is I'm testing and I'm correcting. So next one is conclusion. You have to give your conclusion. I strongly believe that I catered all your requirements and gave you the solutions for all your questions. But still, in case, if you have any queries, I am ready. Okay, I am at your service to give you the valuable information. So that is how you can say. Thank you for patiently listening to me. I appreciate your readiness to implement my suggestions. Thank you very, very much. Have a nice day. So that is how you have to conclude something differently. Just saying thank you and closing the speech. It's abrupt. Be very wise. Then overall, it was okay. It was a good session. You will be standing somewhere about 300, but not definitely 350. Somewhere around 310, 320, we can take your scoring. Your level is C+. Are you happy with the feedback? Now you have 1 minute. Are you comfortable? Can you come on the video? If you're comfortable, you say yes. If you're not comfortable, no problem. Okay, now you can give your words.
Actually, sir, I'm very happy with your suggestions because it is wonderful, and I can say it's awesome because I never get this type of feedback earlier. That's why I was at the level of C plus only. I got 2 times C plus, C plus. I never reached 350, and I was surprised why I'm not getting the desired score. So today I got my weak point, and definitely I will do work hard to improve my speaking, and I will do everything to improve myself.
Yes, thank you very much. Thank you very much. So from tomorrow onwards, be ready to participate sessions like this. Okay, you improve. Tomorrow I'll give you new suggestions, novel suggestions, which will, once you reach B grade, then I'll train you for B plus. You can definitely get you are worth enough. Okay, you deserve not just a B, you deserve B plus. So no need to worry, just follow my suggestions. And if you implement these suggestions in the next session, I'll give you some more, so which will enhance your quality. Thank you very much. Now you can mute your audio and you can close your video.
Thank you, sir.
Then next, Pranita Pamati. Okay. Yes, Rohel Walayat. Okay, just a minute. Hello, Rohel. Hello, Rohel, doctor from Maldives, originally from Pakistan. Yes, Dr. Rohel, can you unmute? Yeah. Okay, Pranita Pamarti. Can you unmute?
Sir, 1 minute, sir. I will tell.
Yeah, okay. Get ready.
Okay, sir.
Yeah. Yes. Are you ready? Okay. Yes, get ready. Yes. Whoever is ready for the speaking session, you can message here. Write your names, attendance. So, yes, Rohel Walayat. Can you unmute? So the speaking sessions will be given only to the regular students. So others can enter and join and practice.
Sorry, sir.
Hello, Rohel, how are you?
Yes, I am having a patient. After that, I would like to go on.
Okay, fine. Whatever you have, you can message. Are you interested to do a speaking session? Let me know. Otherwise, you
Yes,
can
yes.
message me on WhatsApp.
Oh, okay, sir. I will do my. Let me finish my patient.
Yeah, you carry on everything. When you're comfort, I'm there online. So whenever you are free, you can just message me and I'll follow it up. Okay.
Okay, sir. Thank you.
Yes, Pranita Pamarti.
Hi, sir.
Yes. So will you try this speaking session, Pranita?
Okay, sir, I will try. I don't know, but I will
So
try.
I think you are already prepared, right?
No, just I'm heard your voice. Okay, sir, I will try,
Okay.
sir.
Okay, you prepared. Take 3 minutes, no problem.
Sir, thank you.
Sabi Mall, you can attend the session, no problem. I have only given you the link. Yeah, blessing Eriseba. Blessing Eriseba. Hello, blessing. Can you unmute?
Yes, sir.
Yeah, blessing. Can you prepare? Next will be your turn. Okay.
Okay, sir.
Next will be your turn. So prepare. After Pranita, it is your turn.
Oh,
Yes. Pranita Pamarti.
Good morning, sir.
Good morning. Yes.
Okay,
Are you ready?
yes, sir.
Okay. So let us take the card. Yeah. So are you ready? You can come on the video afterwards when you are giving feedback.
At present, no video, sir. I will explain in audio.
No problem. No problem. Okay. Right. So we are going to start now.
Okay, sir.
This is Pranita. Yes. Right. Okay. Right. So, are you ready?
Yes, sir.
Yes, you can start.
Okay. Hi, good morning.
Good morning, nurse.
How are you?
I am fine, nurse. Thank you very much. But I'm little bit anxious, you know. I'm little bit anxious. Yeah. I'm very much worried. I don't know what type of situation I am in. I'm unsure about starting insulin injections. I have been managing my diabetes well until now with my diabetes diet and medication regimen and exercise program. Everything is going on smoothly and I'm leading a normal life, I think. Then why do you want to suggest me something different?
Yes. First of all, how may I address you? Please tell me your name.
Yeah, of course. My name is Lincoln, Abraham Lincoln, and I am 60 years old.
Yes, Abraham Lincoln. Please have your seat now. I know why you came here. I know your reason, and I will explain. Information will be provided. Today, your blood results shows to your blood reports shows to your blood levels will be increased. So the doctor will be recommended to take insulin injection. So that's why I will give information. Okay, information will be provided for you. So try to be not worry. Okay.
Okay, that's fine, nurse. And I'm actually not able to digest this situation. I don't really like the idea of self-injecting insulin. How do you expect me to take injections on my own? I'm not a nurse. And I am really scared about these injections, you know. Even if a nurse gives me, I'm afraid of that one. I don't think I'll be able to do it. I'm sorry.
Okay, no problem. Try to be not worry. Your problem is not not much that nowadays all are suffering like this only, and all are managing themselves only. Okay, it's not a big issue. So don't fear. I will provide information. Information will be provided. And first of all, insulin injection is it is insulin injection self-administration is it is very common procedure. So it's not a painful procedure. Okay, so nothing to be alarmed. So first I will explain how to inject insulin injection. First, you have to clean the area. First, insulin injection will give 5 areas. The upper arms, both the hands, the upper arms, and the thighs, and the above the umbilicus. These are the most painless areas. So you didn't get not that much pain. You didn't get pain eggs. So you can take insulin injection these sides. And first you have to clean the area. First you clean the area and later you inject the insulin injection. So it's not painful. Are you following me?
Yeah, of course, nurse. That's quite obvious and clear. Everything is explained in detail, so I'm able to understand what you're telling. But I want to ask you one thing. Is there any other way to manage my diabetes without these insulin injections?
Oh, sorry, Mr. Abraham Lincoln. Why? Because your blood report shows your increase your blood sugar levels. So nowadays you can't manage without insulin injection. So you have to follow the doctor's advice. I'm not authorized person to change the medications, but you have to follow the doctor's advice. He advised to you should take insulin injections. Um, is it okay?
Yeah, of course, nurse. I understand very much, and the information is clear. Now you can explain me about the procedure of taking these insulin injections and the locations of the sites where I have to take these injections, and how frequent I have to take, and the quantity, and everything related to this. Please.
Yeah, your reasons are considerable. Uh, now information will be provided. First, you should clean the area. Already I told you, this injection is very common procedure. It's not painful. Okay, and we should use. You should use mainly 5 areas. You will be focused. These are two shoulders on the left upper arms and two thighs on the two thighs. Okay, and the areas around the umbilical, so on. Is it okay? Is it clear for you?
Yes, of course, that's absolutely clear.
Okay, then after that, you should clean the area with cotton, with a sterile cotton. Then later, you have to inject the insulin injection. Then after injection, you should remove and you should maintain proper container. It is separated from the other uh, other other waste. You should separately. You should maintain one container and you replace the needles. And later you should close the container. And you after that, main importantly, you do not expose the insulin injection to sun. Okay, just you keep it in refrigerator and later okay sir, that's it.
Yeah, that's fine. And now regarding this insulin injections, okay, I have got a clear picture. Right, then what am I supposed to do with these used needles and syringes?
You should maintain a separate container. You don't use routine dustbin. And later you have to maintain a medical container. Okay, you should proper use only. Why? You should not use above the container. Okay, 3/4 only you should use. And later you inform the medical team. They will take the container. And don't drop the regular waste.
Okay, that's very nice. Thank you very much. And then what about okay, this container, once it is filled, then what am I supposed to do?
You should call me. I will take and I will give. I will take the container. It's no problem. And
Okay, that's
to keep away to children. Why? Because it is safe for you and safe for children also. So you can inform to medical team. They will come
okay.
and collect. They will come and collect the container. Are you having
Right.
any doubts about that?
No, nurse, I don't have any doubts. What all you have told me, that's clearly seeped into my mind. But is there anything else that I need to know in addition to what you have already explained?
Yes. So try to be not worry. It is a common procedure. So nowadays it's not that much. It is not that much big issue. So So try to be not worry, and you should follow up the medications and the dietary patterns, and you should maintain little exercise, means walking like that. You have to follow the medications, so you can reduce your blood sugar levels. So it is not that much serious. Okay, you can live
Yeah,
normal life.
thank you very much, nurse. I feel assured that I can manage. I don't know how far, but until I learn how to do it perfectly, can you come? Can I come here for 3 or 4 days or at least a week? Okay, and learn it perfectly. Then afterwards, maybe I will try on my own.
Okay, are you having any doubts regarding in this injection procedure? Means you can call me, I will explain. Otherwise, I will come to your home and I will demonstrate you. Okay.
No problem, nurse. Thank you very much. Okay. Now
Thank you so
coming to
much.
the point, let me give you feedback.
Thank you, sir.
So, repeated multiple times.
Yes, sir.
Avoid a repetition
Okay, sir.
of the same words. Don't use that. Then you're
Okay,
saying, I will, I will, I will, I will. What is this I doing every time?
yes.
Can it not be avoided? Without I, you cannot speak. Is that the case? No, that is not right. You can speak without I, because here you are, when you are saying I, you are seeking self-importance. You are projecting your importance and your priority, and you are saying that without you, nothing is going on. So give less importance to yourself, and you can say, I will explain you. Explanation will be provided. The procedure will be explained. Education will be given. Knowledge will be offered. So like this, you use directly what important thing that you can focus. The next one, okay, okay, okay. Is that okay? This is not very fine. It is called mannerism. Mannerism is something which is a habit. I don't know why you are saying okay. There is no meaning in okay. Instead of that, one say something which has variation and which shows that you have some excellent presentation styles. If you say okay, it's not going to add anything, and that too repetition is going to pull you down. It's a negative thing. Repetition is a negative thing. You're using ordinary words which anybody can speak, and that also repeating numerous times, multiple times. So that's not favored in OET. So what you can say, I believe that is fine for you. Is your doubt cleared? Do you need any further information? Have you any doubts? Have you any questions? So this is the way how you can say. If you say like that, it will be good for you. Then next one, don't. You already said don't, and again you said don't, because you don't know what to speak next. You use the word, you don't, and again don't. You don't have the next word, you don't have the next sentence ready. So mentally you are shocked and upset, and the reason why you are facing this problem is you are speaking very fast. When you are speaking very fast, you cannot think. So speak a little bit slower. When you think slowly, you will have the thing is you are speaking faster and your ideas are slower. So you're lacking ideas, you're falling short of ideas. If you speak slowly, then by the time you finish the sentence, you'll get another sentence, you'll get another idea, and you can start with that. But without any idea, you're opening your mouth and say, don't. So wait, no, don't even use that word don't, just keep quiet. Recall the sentence, then 1-2 seconds, no problem. The next one. I will provide information, you told. I will provide information. That's very good. It's an active voice sentence. Then immediately what you did, information will be provided, you told. So that means by the time you realized that you are using active voice, the sentence already slipped from your mouth. Okay. So you corrected the sentence in passive voice. You use I will provide is also correct. No problem. If you have already spoken, no need passive voice again, because it already went off. The same thing you are telling in passive voice. What is the use? So next speaking, you can use that one. So you can use it in the next one. No problem. So that's okay. That's okay to use active voice when you have already slipped it off. Then you are saying you. Why are you telling this you so many times? You have to take injection, you have to take the needle, you have to pinch it, you have to take this angulate, so and so you have to. So why this you so many times? You is not important. Okay. So use passive voice. The next one, Mr. Abraham Lincoln. Did I forget my name? Are you reminding my name? Why are you repeating my name? I'm the only one with you. So not necessary to repeat. The next one is, yeah, next point is you have to, see, the thing is, you have to reason. You have to reason. How are you going to reason? You know me. I'm the only patient in front of you. And you know that my name is Abraham Lincoln. So in between, why to take my name when only you are there and only I am there? So why? I did not forget my name. So don't repeat the name of the patient again and again. It looks so, embarrassing. You will not talk to anybody when only two people are there. Don't call them. You'll just say, come here, sit there, go there. No need to tell every now and then you need to take the name. Okay. Name is only for attention, seeking attention. In the beginning, you would seek attention. Once the attention is maintained, no need to take the name of the patient time and again. So remember that. The next one, you should proper use. I don't know why you tell like this one, but maybe you don't have the knowledge of making the sentence correctly. You should proper use. You should proper use. It's not right sentence. Maybe you are in a tension and you use this. Okay. You should use the thing properly. You should use the thing properly. Or you should make a proper use of it. You should make a proper use of it. Or you should use it properly. There are 100 different ways of speaking the same sentence. You should use it properly. Okay. Why? Because you have said something and you said why? Because you should be compliant with medication. Why? Because why are you using the word why? Just say because. No? You should be compliant with medication because. So because is enough. Why is not necessary. Or you can say the reason why you have to be compliant with medication is. Okay. You can tell 100 different ways. Try to explore all the different ways. And you said, try to be not worry. And that you repeated. Try to be not worry. How can you repeat? And that too mistake. Try to be not worry is not right. Try not to be worried. Or do not worry. Or try not to be worried. There is nothing to be alarmed about. The video is on the YouTube. You can write down all these things. There is nothing to be alarmed about. There is nothing to be overly concerned about. Don't be overly concerned about this problem. Finished. 101 different ways of speaking. Okay. This is quite common. And everyone is able to manage the condition. Then why not you? You can definitely overcome this problem. And if you are compliant with medication, definitely you can lead a normal life as everyone else. Only the thing is you're taking insulin injections. Other than that, everything is one and the same. So now regarding your presentation. First one is introduction. You have to give a wonderful introduction. I've already explained what type of introduction you have to give. Yes, please. Come on in. Have your seat. By the way, my name is Abraham Lincoln, and I am the nurse of the day for you. I'm going to be with you for this discussion, consultation. If you don't mind, would you please introduce yourself to me by telling me your name and age first, and then provide me the reason why you are visiting this medical clinic now. Solid introduction, A-grade introduction. Then your confidence level is little wavering. Actually, you're fine, but maybe because you're doing it for the first time with me, you're feeling little confused and puzzled. So no need. I am a patient, I'm not a teacher. Remember that. During the role play, I'm a patient. You are the boss. You are seeing a mouse in front of you and you are a cat. Or you are seeing a goat in front of you and you are a tiger. Like that you have to feel, because you are the boss. You are the man of the show. You are on the hot seat. I'm just a patient, normal patient. I'm not a teacher, I'm not an examiner. So why are you worried? Forget everything. You have to act in the real situation. You have to live in the situation. What do you mean by living in the situation? That means you are a nurse and I'm a patient and you are doing a consultation. How many consultations you might have done in your life? This is another one. This is one other consultation. That's all. It is not totally new to you. But only the thing is you are talking in English here. That's all. Otherwise, you'll be talking in your mother tongue or local or regional language, vernacular language. So, what gives? Only English is new here. Everything is same. Just another patient, just another consultation. You are the same. You have a lot of knowledge. Be strong. Rise up to the occasion and do your best. The next one is grammar. Yeah, you have a problem with your grammar. I don't know whether you are from English medium or some other medium. I don't know exactly. So maybe grammar is your problem. It is your Achilles heel. Achilles heel. Write down this. Achilles heel. Medication compliance is your Achilles heel. You can tell them. That means you are a weak area. So make a diary and note it down. And put an alarm in your mobile phone. Because you have to overcome this problem, and medication compliance is the demand for your situation. Until and unless you're compliant with medication, absolutely, managing your condition will be quite impossible. And it may lead to some serious complications also. But on the other way around, if you stick on adherence to medication regimen, then definitely you can relax. So grammar, learn grammar. Vocabulary. What type of words you are using? What is the modification that you have to do? How are you going to improve the quality of vocabulary? Take a word, try to find alternatives. For example, take another one. Take another alternative. We have a lot of options. Priority basis. You can take anyone. Then pronunciation. Actually, you're running very fast in some situations. Slow down. Take a breath. Release. Slow and steady wins the race. Nobody is running behind you with a stick or a cane. Okay? I'm not punishing you. I'm not scaring you. And relax and do your best. The next one, sentence structures. Use more simple, complex, and compound sentences. If you take insulin injections regularly, you can manage it. You can manage your condition. Now see, if you take your insulin injections regularly, you can manage your condition efficiently. When you take insulin injections regularly, you can manage your conditions regularly. You can manage your conditions regularly, provided that you take your insulin injections regularly. Unless and until you take your insulin injections regularly, managing your condition effectively will be difficult. 101 different ways. You have to take your insulin injections regularly. Otherwise, it is difficult to manage your condition. So there are 101 different ways of presentation. So practice all these things very clear. The next one, accuracy. How correctly you are speaking, how correct is your grammar, how appropriate is your vocabulary, how excellent is your pronunciation. So accuracy is of 3 different types. One is with the grammar, one is with the vocabulary, and one is with the pronunciation. Grammar, vocabulary, and pronunciation. So transform your style in accuracy. Learn how to speak correctly, learn how to use correct grammar, and how to use excellent vocabulary. C1, C2 vocabulary. Next one, fluency. You don't have fluency actually, because number of times you are saying you are actually fast sometimes and slow sometimes. Why don't you strike a balance? You should not be fast, you should not be slow. Reduce your speed, or increase your speed when you are slow. Reduce your speed when you are fast. Make it a standardized style. See, when I'm speaking, I'm not very fast, I'm not very slow. I'm making it a standardized style. Because if I speak very fast, you cannot understand maybe. If I speak very slow, maybe you feel, lack of coherence. The next one, passive voice. Use passive voice as and when it is possible. You are trying to use, but before the sentence you try to use. Otherwise, first today evening, go and try to write some sentences which are useful in the, then change them into passive voice, and then you can automatically practice those sentences. The next one, flow of thought. Flow of thought, how your thoughts one after another have been transformed into sentences. It is called idea generation. Your brain is generating ideas and you are fast. You're focusing on speed. You're not focusing on idea generation. That's the problem. Speaking fast is not right. It's not the only option. You can even speak slowly. No worry at all. Unless and until the fluency is maintained, Speaking slowly is also acceptable. The next one. Subject knowledge. Yeah, you have a lot of subject knowledge because you are an practicing nurse. You have a lot of experience. So in your experience, you have seen a lot of things like this, and you have abundant knowledge, abundant amount of knowledge. So why are you worried? So relax. Only try to recall from your experience. Okay, how you used to speak with the patients. Live like real. Don't go into artificial setup. Think that this is a real interview with a patient. Then automatically you will be perfect because you have a lot of subject knowledge. Reassurance. Your reassurance is just a word length. That's all. It's not real. That I don't feel that I am reassured. So how to reassure the patient? Many people say, I reassure you. Reassuring is not in the word. Reassuring is the action. Now I'm going to reassure you. I totally agree with your concerns. As an individual and as a nurse, I'm going to tell you now. As an individual, I don't have a practical experience about insulin injections because I don't have this problem or condition. So I never know it personally. But as a nurse, I have seen number of people who are suffering from this condition. And once they started taking insulin injections, okay, they have been able to manage this condition effectively and no complications were faced or encountered. So let me tell you one thing. So talk like this. Talk like this. So if all these patients, all these individuals are able to manage their life or lead their life in a wonderful way without any complication, then you can also relax. You are not the only one. Yeah, I have a distant relative. She also is facing the problem. Once every week, she'll be calling me because I'm a nurse, and I'll be asking her about condition. And she says she's very fine. She has got accustomed to taking insulin injections, and it has become a part of her daily routine. And she's happy, beaming with joy, celebrating life. Only the thing is that particular minute you'll take injections and forget it. How does that sound? That's it. So next one, conclusion. Also should be wonderful. I hope I have explained you each and everything regarding the subject and the side effects and the medication, the procedure and everything involved. Now, in case still, if you have any other queries, I am at your service. I'm ready to provide you the necessary information. Thank you very much. Finished. The next one. Overall, it was a good session. And the speaking will give you somewhere around 260 to 280. 260 to 280. That means it's a C grade. No problem. You have a lot of knowledge, I can tell you. But the speed is killing you. Speed thrills but kills. So Pranita Pamarti. Pranita Pamarti. Can you unmute?
Hi, sir.
Now it is your turn. You have 30 seconds to 1 minute to speak. Whatever you want to, you can share your experience.
Thank you so much, sir. Actually, I'm having a problem in grammar. I know. Okay, and one more. I reduced my speed levels. It is very beneficial for me after that. And thank you so much, sir. Okay, sir. I will try to make new sentences, and I will practice the simple and complex sentences. Sir.
Yes.
I will
Okay,
try.
fine. Right. So you can mute your phone. Yes. Yes. Muhiba. Hello, Muhiba.
Yes, hello, good morning.
Good morning. How are you?
I'm fine, thank you.
Yeah, I was waiting for you. I wanted to call you, but
Yeah, because
you were off, so I could not call you. Now this is
yeah,
a live session.
yeah.
Okay. If you are interested, you can practice. You are doing very well. I know that. So no need to worry. I am with you. Everyone is a learner in the beginning stages. We are prone to do mistakes. So no problem. So this is a live session. Okay, be comfortable. And if you are ready to do a speaking session live, you just type in the message. Otherwise, if you are not ready to do live session, then see this Pranita Pamarti, she's a nurse. She first time she came and she did okay, no problem. We are learning. That's all. We don't bother about others. So if you're comfortable,
No,
we'll do.
but
No
not,
problem.
no, sorry.
1 minute. Let me finish. Let me finish.
Yes.
So if you are comfortable, then we can do the session. Otherwise, we can do personal session. What do you think? You want to do here? Means I will arrange a slot now. Otherwise, I will call you personally. What do you think?
You know, I can listen, but I'm not ready to do online the live session.
You are?
No, I don't like to do the live
Okay,
session.
fine. No
Yeah,
problem. No
but
worries. No
I
worries.
can learn. I can listen.
No
to
problem.
other.
We can do our session,
Yes.
live session there, not on the Zoom then. Okay.
Yes.
Okay. Blessing Eriseba.
Yes, sir.
Blessing Eriseba, can we take a break? We'll continue after some time.
Okay, sir.
I'm tired. Okay. So I think you already got many things. So we will continue after some time. Okay.
Okay, sir.
Okay.